Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Then, loop diuretics. In the loop diuretics, the main mechanism of action of loop diuretics is these will inhibit the sodium potassium chloride transporter, which is present in the ascending limb of loop of Henle. So these will inhibit the uh, sodium potassium chloride transporter present in the ascending limb of loop of Henle. So here in the ascending limb of loop of Henle, we have this transporter is present, which is sodium, which causes absorption of sodium potassium and chloride. So when sodium potassium and chloride is absorbed by this transporter, when the loop diuretics block this transporter, then there occurs the excretion of sodium, there will be excretion of chloride, and excretion of potassium is seen in the urine. Okay, so as a result, because of this blockade of sodium potassium 2 chloride transporter, there occurs marked increase in excretion of sodium will be lost, chloride will be lost, potassium wasting will be there. So because of this potassium wasting, it causes hypokalemia, and there will be even H plus ions will also be lost. So because the H plus ions are also lost, this will result in metabolic alkalosis. And in the urine, there is also increased loss of calcium ions and magnesium ions are seen in the urine. So if you see the clinical application or uses are, this can be used in pulmonary edema or hypertension, we can use them, or you can use them in acne or hypercalcemia or hyperkalemia. We can use these in acute renal failure, and in anion overdose also we can use these loop diuretics. So loop diuretics can be used in uh, pulmonary edema, hypertension, acne, hypercalcemia and hyperkalemia because they cause excretion of calcium and chloride, sorry, calcium and potassium. They can be used in acute renal failure and anion overdose. Then side effects or toxicity of these loop diuretics. Loop diuretics, because especially those which contain mercury, they are responsible for ototoxicity. Then hypovolemia is seen in the loop diuretics, potassium wasting is seen, even hyperuricemia is also seen. In hyperuricemia is seen as a side effect. The patient might also present with hypomagnesemia because of the loss of the excess sodium in the urine, excess magnesium in the urine. The patient can also present with complications like hyponatremia may be seen. Metabolic alkalosis is seen in these patients. So pharmacokinetics. The pharmacokinetics of loop diuretics. The loop diuretics are the fastest drug, and they are the most efficient drugs in causing the loss of sodium and water, that is causing excretion of sodium and water, or in diuresis. These are the fastest and the most efficient drugs causing diuresis. They will contain mainly the sulfanilamide moieties. Because of the sulfanilamide moieties, the side effects are seen, or allergic reactions with um, drugs containing sulfanilamide moieties or sulfate drugs has been seen. These will inhibit sodium potassium 2 chloride, and they act on thick ascending segment of loop of Henle. One more important thing is they will activate the tubuloglomerular feedback mechanism. Because they will activate the tubuloglomerular feedback mechanisms, thus they reduce the free water clearance. They are going to reduce the free water clearance. So these are actually well absorbed. And among all those drugs, we have torsemide. This torsemide has earliest onset of action when compared to other drugs. Then we have bumetanide. This bumetanide is the most potent drug. Then we have furosemide. Furosemide is acts for around 6 hours. Furosemide acts for around 6 hours. These will also increase the renal blood flow, and thus they are effective because they increase the renal blood flow. They are effective in acute renal failure. Then the NSAIDs are those drugs which these NSAIDs will inhibit these drugs. NSAIDs will inhibit the loop diuretics.
Thank you and thank you for watching.